Good. Hello, everyone. Good morning. My name is Eleni Anslas with Suburban Hospitals Community Health and Wellness Department. Thank you for joining us today. Um, Today, Dr. Stephanie Van will be presenting on easing the burden of pain, how to manage pain more effectively, how to have conversations with your doctor about pain management. This is a very important topic as we all deal with pain throughout our lives and especially as we age. Um, Before Dr. Van begins her presentation, I just want to go over a few housekeeping items. The first one is that today's webinar is being recorded and we will make sure that it is sent out in the next coming days through a link on YouTube. Secondly, if you do have questions, I'm sure that you do, please put them in the Q&A box on the lower part of the screen, and we'll make sure to answer all of your questions today. And then finally, when you exit the webinar, a link is going to pop up, and that link will take you to the evaluation. We love to hear what you think about the presentation, if it was helpful to you, useful information, hopefully it was, and any topics for future presentations. We take that feedback very seriously. So without further ado, I will Dr. Van, please begin. And thank you again, Dr. Van, for being here. We greatly appreciate your time.
Hi, everyone. Thank you so much for the introduction. I really appreciate you all being here, and I'm really excited to share my presentation with you on aging and pain. Here's my opening slide. There's a meme with someone laying on the floor looking very tired, and it says, "Pain lets you know you are still alive." Man, I feel so, so, so alive right now. So this is me. I'm Dr. Stephanie Van. My pronouns are she, her. I'm an interventional pain management specialist and assistant professor at Johns Hopkins School of Medicine. I'm a Vietnamese woman with my long black hair up in a ponytail today, wearing a gray fleece and green scrubs. And I give continuing medical educational talks on disability medicine all the time. And I'm also a YouTuber in all of my free time. So I make educational content, and I'm really excited to have this session with you today. So learning objectives. By the end of this session, I hope you'll feel more comfortable describing what hurts as the body ages. I hope you'll feel more comfortable talking to your doctors about pain more effectively. And then also we'll discuss some practical steps you can take to reduce pain while aging gracefully. So I designed this to be kind of interactive. It's okay if you want to just put things in the chat or just quietly think of answers in your mind on your own. But I like to have people think about what exactly hurts when we feel pain. Is it a part of the body? Is it a particular type of structure? What is it that hurts? And when it does hurt, how does it feel? Like, there are different ways pain can manifest in our body, not just where it hurts, but how it feels, different qualities of pain. Sometimes people will say things are achy or sharp, tight, throbbing, pulsing. Oftentimes I'll hear people say something feels burning or shooting, electric, sensitive, numbness, tingling, or even depressing. So these are, by all means, this is not an exhaustive list, but these are some common descriptors of how pain can feel. And there's a lot of variety here. So I like to take people through these adjectives first, because each of these adjectives of how pain feels can correspond to a structure in the body that's contributing to pain. Either maybe it's injured, affected by damage or disease. And so let's try to interpret some of these feelings into what structures they might indicate are signaling pain. So one of the main structures in the body that can cause pain are muscles, right? So I have a diagram here on the left of back muscles. They're just kind of like red. If you think about steak, that's a classic example of a muscle everyone's familiar with. Muscles are like layers in a cake. So muscles can be layered across our back. They can be layered, on our arms and legs. And I like to think of them as kind of bundles of ropes as well, kind of pushing and pulling. That's how we move our joints on our whole body. Joints are, where our bones meet in our body. A classic example of a joint is the knee joint here. So on the left, we have this knee joint. We have sort of the top bone and the bottom bone. That's kind of the basic structure of the knee. And the space where they meet in between, there's kind of like the meniscus, or what we call sort of, I think of it as a brake pad. It's kind of a new brake pad. When someone's young, they have like a lot of thick space in between their knee bones. But then as we age, normal wear and tear causes the brake pad to kind of dampen down and get thinner, if you will. And that's sort of the normal progress of aging, or arthritis, if you will. So we talked about muscles and we talked about bones and joints. Here's another diagram of the knee just to kind of give you another visual of how the knee joint can hinge and move. And on the right is a diagram of a knee replacement, where the blue structures are the bones and the orange structures are hardware that's kind of replaced that space between the top and bottom bones to reinforce the joint. That's usually what happens in a knee replacement. I want to talk about the bones specifically of the spine too, because the spine and the back, the back is a very common area, source of pain. And the bones in the spine, they're just like other bones in the body, right? There's joints in the spine, small little joints, where the bones meet in the spine, and those can also experience wear and tear and arthritis. But the bones in the spine also kind of make up a tunnel, if you will. And the tunnel protects our nervous system, like the spinal cord and the nerve roots that go out to our arms and our legs. So I just want to give you these easy examples of how to understand spinal anatomy, because it can feel very complicated. And finally, there's nerves. Nerves are the last major structure in the body that can contribute to pain. Technically, all pain travels along nerves. That's how our body interprets signals, damage, disease, injury, if you will. Nerves are like the wires that send signals from the periphery of our body to the main hub of our nervous system, our spinal cord and our brain. So if you think of these wires kind of traveling through down the main power cord in the tunnel of your back, and then they exit out of windows in the tunnel down your arms and your legs. So just some basic anatomy 101, the major structures that can cause pain in the body: muscles, bones and joints, and nerves. Okay, so let's bring it back to causes of pain. So what happens when muscles are painful? When muscles are painful, we get some achiness, soreness, tenderness, tightness. Sometimes people will experience spasms or knots that they want to like massage or rub or put heat on. Very classic for muscle pain. And this is very common, happens at all stages of life, right? Like if you lift a heavy box or you twist the wrong way, you can strain a muscle. Then there's bone pain, especially bone pain associated with arthritis can feel achy, stiff, sometimes sharp. Sometimes it's worse when you're standing or walking from a long time, because the prolonged movement and gravity can kind of wear and tear on your joints. And then of course, like bony injury, like a bony fracture, that can be extremely painful. And then finally, nerve pain has these hallmark characteristics of burning, electrical, numbness, sensitive, tingling, and shooting. Usually those descriptors are very classic of a nerve-mediated issue. Finally, there's visceral pain. Not finally, second to last is visceral pain. Visceral meaning like the internal organs. And this is more vague because our internal organs, we don't have as many discrete signals. We don't know specifically, is this our stomach pain? Is this our kidney pain? Is this our bladder? Sometimes it's non-specific. So that can feel like a deep pressure, can feel like bloating, swelling, or stabbing. And the distribution might move around because our body's not as good as signaling from the deep internal organs. Finally, I want you guys to know about centralized pain. When I talk about centralized pain, I'm referring to the central nervous system, like the brain and the spinal cord. Any type of centralized pain, no matter how someone might describe it with adjectives, it's usually out of proportion to the actual tissue injury or disease that is happening. So for example, if someone had a bony injury, like they had a fracture, but then thankfully, 2 to 3 months later, that fracture is completely healed. But if someone's still having a lot of pain, burning, shooting, throbbing, even though the fracture is healed, that translates then to centralized pain, where the pain is still exaggerated even though the injury has passed. This can mean that the central nervous system is still prone to signaling and exaggerating the pain signal, trying to warn the body that something's wrong, even though the danger has passed. So I really like to think about these different types of pain, and even just helping you understand the types of pain that are out there can help you wrap your head around what experiences or feelings that you might feel when you're in pain. Of course, you know, especially as we age, but throughout our lives, aside from pain, there's a lot of associated concerns that we think of when we worry about our function and our quality of life. Pain might be associated with things like weakness or numbness, lightheadedness or dizziness, fatigue, like limited endurance, or our nausea, our appetite might be affected. We might be worried about our balance and we might be worried about falling. We might be worried about incontinence. What if we're having bladder or bowel changes, constipation, diarrhea? And of course, our mood. Pain can be associated with depression, anxiety, even just anxiety about trying to understand what is going on with our body. All right, just to break it up, here's a meme of a older gentleman leaning over, grabbing his back, looking uncomfortable. And it says, tired of carrying around my sense of humor all day. Okay, so now that we've kind of put some adjectives and associated them with parts of the body that can cause pain, let's bring this to the doctor's office and um, understand how your doctor might help you interpret these signals. So your doctor should ask you, what does the pain feel like? I like to have people rank their areas of pain because usually it's not just one thing that's bothering someone. Usually people will come in with like a list of, you know, sometimes up to 10, 12 things that are bothering them. So I like to have them rank their areas of pain, starting with number one. What's the number one most bothersome, painful, interruptive thing in your life that's bothering you right now? That way I know we can spend the most time on that issue because it deserves the most priority. They'll ask you where it is, if the pain spreads anywhere else, the timing of the pain. Does it only happen when you're walking? Does it happen at night? How bad is it? Is it preventing you from sleeping? Is it preventing you from doing the regular functional activities you need to do throughout your day? And then, of course, it's really important to tell your doctor what makes the pain worse and what makes the pain better. We also call this aggravating and alleviating factors, and these give us more clues into, you know, what could be causing the pain and what might help the pain. So, for example, if walking makes your back pain worse and it's kind of radiating to your thigh, that's a very classic sign of low back arthritis. What makes it better? If heat or massage makes your back pain feel better, that might be more of a muscular or arthritis mediated pain more so than like a nerve pain. Okay. Your doctor should also examine you during your, at least your initial evaluation. They might check your strength and sensation. They might check your reflexes. It's really helpful to watch someone walk actually, just to see how they get from point A to point B. That might tell your doctor how much your pain is impacting your mobility. They might check for tenderness, as in they might push on the areas that are uncomfortable and see if that provokes some pain. And they'll also try to reproduce your pain with special maneuvers. They might move your legs around or your arms around. They might, you know, check your reflexes to indicate if there's any structures that are specifically involved with your pain. Okay, so once you've talked to your doctor about the symptoms you're experiencing, and then your doctor has examined you for any signs that might correlate with your symptoms, then your doctor should then move on to what their assessment is, what they think is going on, and hopefully provide you with at least a preliminary diagnosis. So if muscles seem to be the primary contributors to your pain, they might tell you that there's been a muscle or tendon injury or a sprain or a spasm. A contusion is kind of like a big bruise where there's been an impact. So if you had a bad fall and you felt like there was some soreness, tenderness, and bruising in that area, that's an example of a contusion. And that can happen to muscles or bones. If there's a primarily bony injury that's suspected, like a fracture or dislocation, that's traumatic, whereas there's more wear and tear type injuries like arthritis and things that happen with time. When it comes to nerves being painful, they can be dysfunctional because of, you know, time and age, like neuropathy. They can be injured because of like pinching or stenosis, like if something's physically irritating them. And not only can they be painful, but when nerves are not signaling properly, they can also affect your strength and your sensitivity. If there's organ dysfunction, like your internal organs aren't functioning properly and that's contributing to pain, you know, that's kind of a specific diagnosis. And then, of course, your doctor should also look out for your mental health and support your mental health being assessed, even if they're not a mental health specialist. That's always something to consider when someone's in pain, because not only is pain in your nervous system, but your mood, your stress, your sleep, that's also involved with your nervous system. So you have to treat the whole picture. All right, so here are some anatomical diagrams of sort of common things that happen in the back that cause back pain. So on this right-sided diagram here is a close-up picture of the spine. You're kind of looking at from the kind of the side back angle. You see these yellow wires are kind of the spinal cord running through the tunnel, and these bones are the vertebral bones that kind of form the bony cage around the spinal cord to protect it. The red kind of fuzziness here where these bones are meeting, this is representing wear and tear and arthritis at these facet joints. So these are the lumbar facet joints that can experience wear and tear and cause arthritis pain in the back. On this left side here, there's a diagram of a person where their leg is red, indicating an area of pain. And out of their spinal tunnel are some blue wires that represent the sciatic nerve. You may have heard of the sciatic nerve. It's a classically painful nerve that when it gets irritated, it causes pain shooting all the way down the back of the leg into the foot. So that's a very classic sign of sciatica. The reason this nerve gets irritated or pinched, there's a close-up here you might be able to see is these little, it's almost as if you're taking a bunch of spaghetti and you've cut them so that you're looking at a cross section of a bunch of spaghetti, these yellow spaghettis here. Part of the structure of the tunnel are these discs, these jelly cushions that sit between each of the spinal bones. And when these jelly cushions, when they get worn and torn, they can kind of poke into the tunnel where the spinal cord's running. So they can kind of narrow the space where the spaghetti wires are running. That's usually a common reason for spinal nerve root irritation, as the spinal nerve roots exit the tunnel and go down the leg. Just some basic spinal anatomy 101. Spinal nerve root irritation from a herniated disc and spinal arthritis are two of the huge common reasons for someone to go to their primary care doctor or their pain doctor for symptoms. Okay, so now that we've talked about a lot of anatomy and sort of what your doctor might interpret for you, it's time for you and your doctor to collaborate on a plan. If this is the first time you're ever talking to a doctor about these symptoms, as they're quite new, your doctor might want to order some additional tests to get a better picture of what's going on. They might get some x-rays, they even might get an MRI, which is a very detailed level image. They might present you with things like lifestyle changes, activities or exercises you can do. Usually these are very conservative, low risk things that are easy to adapt. They're things that you can control. No matter what, these are sort of the first line of defense against most pains, especially pains associated with aging. It is my personal belief that doctors should sort of act as a connoisseur or a guide, if you will. I think doctors' jobs is to present you with a menu of options, and your job is to kind of pick and choose what sounds good to you, and they should support you in your decisions and help you towards your goals. So if someone only wants to look at lifestyle changes, a doctor shouldn't necessarily push medicines or injections, or vice versa. If someone would rather, pursue injections and they don't want pills, the doctor should hopefully shift the conversation in that direction. Your doctor might refer you to formal therapies like physical therapy, which is usually dealing with mobility, like getting from point A to point B and strengthening, working on endurance. There's also occupational therapy, which deals more with the upper extremities and fine motor movements. You can also think of occupational therapy as working on your activities of daily living, like self-care, getting dressed, bathing, those kinds of things. And then there's mental health therapies like counseling, pain psychology, ways to help someone cope with pain or anxiety or past trauma. Then, of course, there's medications. Medications come in all different forms, right? There's creams, there's patches, there's pills. There's also injections. So you could technically inject most joints in the body. You can inject muscles. You can even do injections along nerves. So there's lots of different ways to target painful structures with the minimally invasive method of injections. Some people don't like needles, and some people prefer needles over pills. Then, of course, the most invasive interventions you could consider for pain are surgeries. Surgeries are the most invasive option. They usually involve cutting. You usually have to be put to sleep for these types of procedures. But these are the procedures that can definitively structurally open up a spinal tunnel or correct the wear and tear in a joint, for example. That being said, surgeries still aren't a guarantee. So even if someone structurally improves their anatomy, so like their imaging looks much better than it used to, their pain might still persist. So surgery, even though it's the most invasive and the highest risk, it's not always the biggest reward. So it's definitely something to consider with a grain of salt. And it's best to consider all of these options to really maximize your chances of improving your symptoms. I think it's really helpful for people when they visit the doctor's office to ask for a summary of the plan and sort of ask for some follow-up. Like at the end of the visit, if the doctor's kind of overwhelmed you with a lot of information, which sometimes I can do that, or if you just feel like they talked in a way that with language that was hard to understand, it's nice to let your needs be known because you should be in control of your healthcare decisions. You should understand what's going on with your health and what options you have. So asking for a summary is, not that much extra work for the doctor. If anything, that's already part of what they're supposed to be doing for you, is helping you understand these things. And then hopefully you've set a follow-up appointment so that in, 6 weeks or so, you can check in with the progress and see how the plan is going and see if you need to re-strategize. On the right here, I just have some additional x-ray pictures of like the neck bones showing some arthritis and also the knee bones showing some arthritis and joint space narrowing. Okay. Just a little side note about your plan with your doctor. Obviously, if we're talking about pain and graceful aging, the priority is usually pain control, and usually improved function, if you will. But hopefully your plan also covers any associated concerns you have with your symptoms. Maybe the plan addresses any weakness or numbness you have, or the lightheadedness or dizziness that's been associated with your symptoms. Or, make sure if you're also concerned about fatigue or endurance, your balance, bladder or bowel changes or mood changes, if those are strongly associated with your pain, it's important to make sure your doctor is aware of that. And even if they can't directly help you with these symptoms right away, maybe they can refer you to another specialist who might be able to help you further. Okay. I just want to move on now to sort of what these strategies are. Like, what might your doctor specifically recommend for you, and what things might you be able to control in your everyday life to keep your body aging gracefully? I always like to emphasize lifestyle strategies. Like I said, they're always the best first line of defense. They're risk-free, and a lot of them are not super expensive, which is nice. So I always think about the nervous system first. I think about mindfulness, meditation, things like journaling. These are ways to consciously influence our nervous system and help our nervous system react to pain and stress in a less exaggerated way. So no matter what, even if we're in a lot of pain, even if we're dealing with a serious injury or a serious disease, having some conscious control of our pain and stress response, that's always a helpful thing to get us through hard times. Coping strategies can include like mental health counseling, having a strong support system, whether that be family, friends, religion, or distraction. Some people just really like certain hobbies and that kind of keeps their mind off of their pain. Focusing on nutrition, right? Putting good things into your body usually helps people feel good versus putting not good food into the body is, the opposite. Sleep regulation. So sleep is an important way that our nervous system kind of rests, relaxes, and kind of recovers from stress or pain. And so doing your best to get on a regular sleep schedule and getting enough sleep is something we can try to control. There's different modalities that we can use even at home. Modalities include easy things like a heat pack or an ice pack, massage. You can explore things like acupuncture or aromatherapy, sometimes with holistic specialists. Regular physical activity is always good for the body, right? Our bodies are made to move. Our bodies enjoy being active. Something as simple as stretching a little bit every day, dancing, tai chi, yoga. I usually tell people to find ways to move that they enjoy so that it doesn't feel like a chore. It doesn't feel like, prescribed exercises. I tell people to put your favorite song on and kind of even just set a timer for 5 to 10 minutes. And even if you've just moved during those 5 to 10 minutes, however you moved, you deserve credit for getting your physical activity in. And ultimately, your focus should be on your functional goals, right? Sometimes pain can't go all the way to zero. Sometimes we can't completely get rid of our pain or our troubling symptoms. But if we focus on functional goals, like if we want to be able to walk to our mailbox, or if we want to be able to go on a trip or something like that, those are the goals that keep us motivated to maintain these lifestyle strategies. Okay, here's a meme that says lavender reduces stress, and it's a lady looking very stressed, laying on a bed covered in lavender. All right, when it comes to functional goals, I put this graphic up here encouraging you to make your goals smart. So specific, measurable, achievable, realistic, and time bound. Um, I I just encourage you to forgive yourself for not being perfect, right? We all know that eating healthy, sleeping more, exercising more is good for us, and yet it's not easy for most of us to do. So when it comes to behavioral changes, lifestyle changes, it's easiest to focus on one habit that you can and want to change. Just kind of keep it really narrow and focused and achievable. If you maintain that habit for 30 days, say, you can pat yourself on the back and say, hey, I can actually do this. I can do this for 30 more days, and then, 3 more years, hopefully. And you should give yourself credit for the progress that you've made. And then once you've kind of ticked off one goal and that's become an easy part of your routine, you might consider the next habit you want to change. And that's how we can build sustainable changes. Okay, here's some examples of coping strategies here. We've got a picture of someone meditating. We've got a picture of someone journaling. But these are just kind of classic examples. Many people cope in many different ways, watching movies, talking to friends. You might have coping strategies that you do regularly that you don't even recognize as coping strategies. So it's okay to think about that more, be mindful of that, and give yourself credit for that. Nutrition. So here's a picture of lots of different colorful fruits and vegetables and grains. Whole grains tend to be better. I'm not a nutritionist. I feel like this is just a good way to encourage you that your diet and what you put into your body is something that you can, for the most part, control. Sleep. Here's someone sleeping comfortably with a sleep mask. I kind of already touched on this already, but I try to encourage people to get on a regular schedule, try to get at least 7 hours of sleep. It's hard for people to feel well rested. And so if sleep is something you're really struggling with, even aside from pain, that's something you can talk to your doctors about to get more tips about how to optimize that. Physical modalities. So I did mention things like heat, ice, and massage. Another modality pictured here on the left is a TENS unit. Some people don't know what a TENS unit is. There's sticky pads involved, like electrodes. So you can put those on a painful area like your back muscles or like around your knee. And these sticky pads are connected to a little machine where you turn up the stimulation. The electrodes might feel like a kind of buzzing or tingling sensation. If you turn up the stimulation high enough, these electrodes will actually start to contract and relax your muscles. And that can kind of scramble pain signals, override them, and it can also shake out muscle tension. So TENS units can be really helpful for, strengthening an area that's been deconditioned or reprogramming an area, if you will, that's been kind of hypersensitized to pain. A lot of people first try TENS units in physical therapy, but they're also available, you can buy them for use at home if that's something you found helpful. And here is a picture of a chair yoga class and just another slide to encourage people to explore some healthy, safe, and fun movements that you enjoy, and that's how you get your regular physical activity in. Okay, there's medications for pain. And I feel like I could give a whole other lecture, or maybe 5, on the different medicines out there for pain. But what I'll leave you with is that there's a ton of medicines for pain, and most of these medicines have a specific kind of indication. So if you think of muscle pain, joint and bone pain, nerve pain, so you think of the different types of pain, that corresponds to the different medicines for pain that are out there. So for muscle pain, you might be offered a muscle relaxant. For arthritis and bone pain, you might be offered an anti-inflammatory. For nerve pain, there are specific nerve medications, and there's some overlap with these. So some medications will do more than one thing. So for example, there are some nerve medicines that also cause drowsiness, very commonly as a side effect, but that can help someone who has nerve pain and aren't sleeping well. Some nerve medicines also boost norepinephrine and serotonin in the brain, which can also help with mood. So if someone's dealing with pain and anxiety and depression, that might be a good fit for them. So even just knowing the types of pain you have, that can lead you to a productive conversation with your doctor about what types of medicines might be a good fit for you. And medicines come in all different forms. I think I mentioned earlier, some of them come in topical creams or patches. Some of them come in tablets that you can crush and are easy to swallow. Capsules is a very traditional way a medicine comes in, or some even come as liquids, which are a little easier to swallow than pills. So you can ask your doctor about all of your preferences and what options exist for you. Okay, one question I get asked a lot is, aside from all these conservative measures, right, the lifestyle changes, the therapies, the medicines, when might someone consider injections or surgery, these more invasive options? I'll emphasize again that no medical or surgical treatment, none of these treatment strategies are risk-free or guarantee satisfaction. Like I said earlier, surgery is usually the most invasive and risky strategy. And I always encourage people to get as much information as possible, because even if you get 2 or 3 different opinions, that just gives you a well-rounded picture of how you might make the most informed decision about what's the best route to pursue for you. So I talk to people about surgery, and when they might consider it, if they've really exhausted these conservative measures, like if they're doing the therapies, they're on a couple of different medicines, they're sleeping enough, but they're still not getting a functional benefit or satisfactory relief, then interventions or surgery might be the next level, the next way to level up the pain control. Of course, if there's a severe life-threatening tissue injury, like if someone has a sudden trauma or an infection, or blood flow to a limb is compromised, the only way to definitively reverse that is a surgery. And then when it comes to back pain, most back pain is pretty benign, associated with aging, and is just painful but not really an emergency. Whereas some back pain might be associated with a sudden loss of strength in the leg, for example, sudden loss of sensation, or bladder or bowel control loss, like incontinence, like someone empties their bladder and they don't even realize it. That might indicate sort of a traumatic or sudden disc herniation, where a nerve root is really pinched or irritated, and the nerves that send signals to the bladder or the legs suddenly aren't functioning. These are all red flag symptoms that should warrant a visit to the emergency room for quick workup and evaluation to see if something can quickly be reversed. Okay. Ultimately, when you're working with your doctors on your pain and your functional symptoms, the goal should be focusing on your function and quality of life. Your doctors are there to support you and guide you throughout your medical decisions. And hopefully they, are supporting you living your best life. They want you to return to the activities you enjoy. They want you to have quality time with your friends and your family. So hopefully these discussions are also part of your conversations with your doctor. Hopefully that you're talking about your family. Hopefully you're talking about the hobbies you enjoy, because that really brings the human aspect into all of this medical stuff that you're trying to translate for yourself. So pictured here are lots of different people of different ages and body types. Some people are in wheelchairs, some people are walking, some people are playing with kids, doing yoga, playing tennis, all the good stuff in life. Okay, so in summary, pain flares up, but it can calm down. It's important to take note of where, when, and how your pain happens, because this is important information to relay to your doctor to help interpret what could be causing your pain. It's really helpful when you talk to your doctor to rank your symptoms in areas of pain so that the most bothersome symptoms get prioritized and get the most time. Different strategies for pain management target different types of pain, like different medicines, different exercises, etc. It's important to focus on achievable functional goals, usually pain control, and minimizing risks. You can help yourself practice mindfulness, stress management, and lifestyle changes, because these are some of the things you can control. Work with your healthcare team to pick treatment strategies that best suit you and your goals, whether that's minimizing medicine side effects, whether that's maximizing conservative stuff and avoiding riskier interventions, what have you. So coming to your doctor's office with those goals in mind really helps you make progress and make the most of your time with your doctor. Okay. Thank you so much for sitting through this entire talk. I really appreciate your time. My final meme, this is a diagram of a person with back pain, and it says, "My body is a temple, ancient and crumbling, probably cursed or haunted."
Thank you. Thank you, Dr. Van. I think sometimes that humor is the best medicine. We have to kind of like laugh at ourselves and what we're going through to kind of bring levity. So thank you so much. I wanted to open the floor to questions from our participants. I know that there was a question that someone asked if medical cannabis does it help with pain management, and is it, how to, is it appropriate? But I will let you answer that question.
Yeah, that's a great question. I get asked about medical cannabis a lot. I did my fellowship in pain management in California, where it was much more readily available. And I think very recently, I think within the last year, it became available recreationally in Maryland as well. So I think people are more curious about it since it's become more of an option. I'll say this, what we know from the pain medicine literature is that CBD and THC, these two kind of different formulations that are available, can be helpful for pain management as well as things like anxiety and sleep management. Lower doses tend to be more helpful than higher doses because usually people who are looking for pain relief aren't looking to be, inebriated or, they're not looking for a good time. They're looking for pain management. So typically lower doses help influence the nervous system in a more effective way. I don't recommend smoking anything because, as a healthcare provider, that's not good for the body. But there are like oral formulations, drops, edibles, and even topicals. I think one of the limiting factors is cost. But for the most part, I would say the potential benefits may outweigh the risks. Starting at a low dose is usually safer, and having open conversations with your doctor about, what you're interested in is always a good strategy.
Great. And when you talk also about the edibles, you're referring to gummies as well. Yes.
Yeah, honestly, I think there's a lot of different oral formulations. So I think there's gummies, there's like brownies.
Yeah,
A dispensary honestly would probably be able to take you through more of a menu of things.
I agree. All right. Thank you. I had a few other questions for for my own benefit too, but you talk about how pain can flare up and then it subsides. So um if it because sometimes I feel like when we're in chronic pain, we never think it's going to subside. So why does it subside, first of all? And then also, can you talk about because I had pain once and the doctor told me to take, a double dose of Aleve, for example. This is my personal. And I was like, "Are you sure?" And he's like, "Yeah, it's fine." I'm like, "Okay." But I was like, doesn't that also kind of affect the liver and all that? So if you could just touch on those two things, I'd
Yeah,
appreciate it.
absolutely. I agree that people who have chronic pain, right, the ones who, they've had pain for many, many years, it's hard to tell someone who's experienced pain for that long, like, oh, this could go away or this could get better. Um, every person is different. And so honestly, like I'm not saying that pain can completely go away or will completely go away, right? When I was talking about sort of functional goals, I like to focus people not on the pain score and the existence of pain, but more what they can do in their lives despite the pain, right? So if someone's pain score is kind of steadily at like a 5 and, maybe their pain is not debilitating, but you can give someone more tools to cope with their pain better, manage their pain when it does kind of flare, like maybe with certain activities, or maybe it's due to a disease process that kind of fluctuates. You can still encourage them to focus on the things in their life that they'd like to achieve, despite their pain. So people can still travel with pain, people can still spend time with their family, do recreational activities with pain. And so that's kind of like the whole goal of working with your pain management doctor is to still be able to live your life despite, pain's going to be there. Pain's going to go up and down. Let's see. To address the second part of your question, sort of, when a doctor just tells you, oh, just do this, it'll be fine. And it's normal to have hesitations. It's normal to kind of be like, is that real? I think that's kind of on the doctor to, help you better understand why they're recommending something. It's a little outdated if a doctor just expects a patient to kind of do what they order. That's a really old school strategy of medicine. And these days we want people to feel empowered. We want people to feel in control of their situation, even if that just means one, understanding what is causing their pain. Because if there is an inflammatory process, for example, if it's sort of like a joint pain flare, if you will, or like, if a certain activity like a long car ride kind of aggravated pain, sometimes a big dose of medicine can kind of nip things in the bud. The body's kind of cyclical in that way. And so if you're kind of up in a vicious cycle of pain, inflammation, what have you, you can break that cycle potentially with a big dose of medicine or sometimes with an injection. And then once things calm down, you probably won't need such high doses. But you're always weighing the risks and benefits of interventions, medicines, etc. I think there was one more thing I was going to say. In terms of dealing with chronic pain for a long time, I always try to reassure people that pain is all in the nervous system, right? The way we perceive pain, the way we perceive stress, our mood, it runs in our nerves, our nervous system, our brain. And our nervous system is really good at learning and unlearning. So I've met a lot of people who've been in pain for many, many years, and giving them that knowledge of, I can teach my system how to not react so much to pain. I can teach my system to tolerate functional activities that I know aren't harmful, that I know is not causing any physical damage. That can help the system adapt to not signaling such heightened pain signals with normal functional activities. And that is how pain can kind of calm down and reduce, even if it's been hanging around for a while, simply because you've kind of helped reprogram yourself a little bit.
Thank you. Thank you very much. I appreciate it. You mentioned also, pain that starts in the nervous system, and I was doing some preliminary research, and I saw that what was it? It was that Alzheimer's, that the chronic pain can also be associated with Alzheimer's, but it's like was preliminary research. Have you heard of this, or have you seen anything that would suggest otherwise, or?
I mean, to be perfectly honest, I'm not sure of that link. And like you're saying, probably there's some preliminary research. I would say pain is vastly, vastly more common than Alzheimer's itself. Um, if
Yeah.
anything, it's like at least 50% of the population will experience back pain at some point, and that's just one part of the body.
Mm-hmm.
Um, so regardless, I think pain is something everybody eventually may have to deal with, and or a loved one will have to deal with. So it's kind of inevitable, and giving yourself as many tools in your toolbox to deal with the pain helps. Giving yourself a good team and support system around you, whether that's friends, families, and healthcare providers, that gives anyone the best chance of, successfully navigating their pain.
Thank you. Does anyone else have any questions for Dr. Van? Well, if not, speak now or forever hold your peace. Did you have final thoughts?
I do have a final thought, just because I do this kind of thing all the time. So I'm just sharing my screen one more time. I love doing educational talks. I love talking to people about healthcare, about medicine, and, disability. So I actually have a YouTube channel where I make content like this. I interview people with disabilities. Sometimes we talk about fun stuff like movies and TV. But I even made a video with my friend AJ about sort of the top 7 tips for patients when they go to the doctors, how to make the most of their time. So very similar to this type of content. So if you're interested in this type of stuff, if you want to see more of me and some of my friends, I welcome you to check out This Ability Clinic on YouTube. I put the QR code up here on the slides, and here's some thumbnail examples of some of the videos we have. So I'd be very honored if you checked that out.
Thank you. Thank you so much, Dr. Van. I will check it out. I appreciate YouTube and its potential benefits. So thank you. And thank you for sharing your knowledge with us today. We will make this webinar available in the coming days. And so I will say thank you, and we'll see you the next time. Thank you, everyone.
Thank you for watching, listening, and learning. See you later.
Thank you. Bye.